What if your gut problem was tested, but not for the thing that was actually hiding there? Many older adults deal with bloating, loose stools, stomach cramps, strange fatigue, skin itching, or bowel changes that keep returning. They may be told it is age, stress, poor digestion, or something they ate. Sometimes that is true, but sometimes one category is never properly checked: intestinal parasites. Worldwide, this is not a rare issue. The World Health Organization estimates that soil-transmitted worms affect about 1.5 billion people, nearly 1 in 4 humans. Most cases are concentrated in areas with poor sanitation, but parasites are not limited to distant countries. Giardia, for example, can spread through contaminated water, food, surfaces, or close contact, even in modern communities. Here's the part most people never hear. Not every stool test looks for parasites. A routine stool culture is usually designed to look for bacteria, such as Salmonella or certain forms of E. coli. But parasites, eggs, or cysts often require different testing, such as an ova and parasite exam, Giardia antigen testing, or other specialized stool tests. That means someone can say, "My stool test was negative," while the exact organism causing the problem may never have been searched for. And one sample may not be enough. Some parasites are not released into every bowel movement. That is why doctors may need several stool samples collected on different days when parasites are suspected. This video is not about fear, and it is not about replacing medical care with a homemade cleanse. Foods like garlic, ginger, pumpkin seeds, and fiber may support the gut environment, but confirmed parasitic infections often need the right diagnosis and the right treatment. So if your gut symptoms keep coming back in cycles, if your stool looks greasy or unusually foul, if fatigue will not lift, or if you notice nighttime itching around the anus, do not ignore the pattern. Before we talk about natural gut support, you need to understand why parasites are still being missed, even in places where people assume they no longer exist. Many people hear the word parasite and immediately think of remote villages, unsafe drinking water, or travel to faraway places. That belief is exactly why some infections are missed. Parasites are more common in areas with poor sanitation, but they are not locked outside modern countries. Giardia is one of the clearest examples. It can spread through contaminated water, food, surfaces, and close contact with an infected person. You do not need to see dirt. You do not need to smell anything strange. A microscopic amount of contamination can be enough. This can happen after swallowing lake or river water while hiking, camping, or swimming. It can happen from food washed with unsafe water. It can spread in childcare settings, long-term care facilities, or households when hand washing is not careful enough. It can also follow travel, especially when the digestive system never fully returns to normal after a stomach illness. That is why the old idea that parasites only affect people in poor countries is misleading. The risk may be lower in places with clean water systems and strong sanitation, but lower risk does not mean zero risk. There is another mistake, assuming all parasites are worms. Some intestinal parasites are protozoa, which are tiny single-celled organisms. Giardia, Cryptosporidium, and Entamoeba belong in this category. They are too small to see, but they can still trigger diarrhea, bloating, cramps, nausea, greasy stools, dehydration, and fatigue. Other parasites are helminths, such as pinworms, hookworms, roundworms, or tapeworms. These can behave very differently from protozoa. A pinworm infection may cause intense itching around the anus at night. Hookworm may contribute to blood loss and iron deficiency anemia in heavier infections. Tapeworms may be linked with digestive symptoms or nutrient problems depending on the type. This is why guessing is dangerous. A person may say, "I think I have parasites," but the real question is, which organism, if any, is involved? Not every case of bloating or loose stool is caused by parasites. Irritable bowel syndrome, lactose intolerance, gallbladder problems, medication side effects, inflammatory bowel disease, thyroid disease, food poisoning, and even colon cancer can create overlapping symptoms. But when digestive symptoms keep returning, especially after travel, contaminated water exposure, unexplained weight loss, greasy stools, nighttime anal itching, or fatigue that does not make sense, parasites should not be dismissed too quickly. The body may be sending signals. The challenge is learning which ones matter most. Now let us look at 5 warning signs that may suggest your gut is dealing with something more than ordinary indigestion. Sign number 5 is fatigue that does not make sense. Fatigue alone does not prove parasites. Many conditions can cause it, including poor sleep, anemia, thyroid problems, depression, medication side effects, kidney disease, and vitamin deficiencies. But when fatigue appears together with recurring diarrhea, unexplained weight loss, greasy stools, or low iron, it deserves closer attention. Some intestinal infections can interfere with hydration, appetite, and nutrient absorption. In older adults, even mild dehydration or poor absorption can create heavy, stubborn tiredness that does not fully improve after rest. Sign number 4 is unexplained skin irritation with digestive symptoms. A rash, itching, or hives does not automatically mean parasites. Skin changes can come from allergies, dry skin, medication reactions, liver disease, kidney disease, eczema, or many other causes. But when new skin symptoms appear alongside bloating, bowel changes, fatigue, or recent travel exposure, they may be part of a larger pattern. The gut and immune system are closely connected. When something irritates the digestive tract for weeks, the immune system may become more reactive. That does not diagnose parasites, but it should raise the question, what is keeping the gut inflamed? Sign number 3 is recurring diarrhea, bloating, and foul-smelling stool. This is one of the stronger warning patterns. Giardia, for example, can cause diarrhea, gas, stomach cramps, nausea, fatigue, and stools that are greasy, unusually foul-smelling or floating. The timing can fool people because symptoms may begin 1 to 2 weeks after exposure and last for several weeks. That means today's gut problem may be connected to lake water, travel food, a stomach bug, or contaminated surfaces from days or weeks ago. Sign number 2 is anemia, weakness, or unexplained weight loss. Not every parasite causes anemia, but hookworm is a classic example of how an intestinal parasite can contribute to blood loss. In heavier infections, the parasite can attach to the intestinal wall and feed on blood, increasing the risk of iron deficiency anemia. For a senior, this may show up as weakness, shortness of breath with mild activity, dizziness, pale skin, or a drop in stamina. If iron supplements do not seem to help, or if anemia keeps returning, the cause should be investigated instead of guessed. Sign number 1 is nighttime itching around the anus. This is one of the most specific warning signs, especially for pinworm. Female pinworms can move to the skin around the anus at night to lay eggs. This can trigger intense itching, poor sleep, irritation, and repeated scratching. The timing matters. Random itching can have many causes, but itching that is worse at night, especially in a household where others also have symptoms, should not be ignored. One more sign is often mentioned online: intense sugar cravings. Be careful with this claim. Sugar cravings alone do not diagnose parasites. They can come from poor sleep, blood sugar swings, stress, restrictive dieting, or habit. At most, cravings should be treated as a minor clue only when stronger symptoms are present. The real danger is not one symptom by itself. It is the pattern: recurring gut problems, strange fatigue, stool changes, weight loss, anemia, travel exposure, or nighttime itching appearing together. These signs matter because parasites do not simply sit in the gut. Some can disrupt digestion, absorption, hydration, and immune balance. Parasites can affect the gut in different ways depending on the organism. Some irritate the intestinal lining. Some interfere with absorption. Some trigger diarrhea and dehydration. Others may contribute to nutrient loss over time. The important point is this: your gut is not just a tube that moves food. It is an ecosystem. It contains digestive enzymes, protective mucus, immune cells, friendly bacteria, and a delicate lining that helps absorb nutrients while keeping harmful invaders out. When an intestinal parasite settles in, that ecosystem can be disturbed. Take Giardia as an example. Giardia can attach to the lining of the small intestine and interfere with normal digestion. That is one reason some people develop bloating, cramps, gas, nausea, and stools that are greasy, foul-smelling, or floating. When the gut cannot absorb nutrients properly, a person may lose weight, feel weak, or become unusually tired. For an older adult, this matters even more. Diarrhea is not only a bathroom problem, it can quickly become a dehydration problem, a dizziness problem, and even a fall risk problem. A senior who loses fluids for several days may become weaker, less steady, and more vulnerable than a younger person with the same infection. Some parasites can also contribute to nutrient problems. Hookworm is one of the clearest examples. In heavier infections, hookworms can attach to the intestinal wall and feed on blood. Over time, this may lead to iron deficiency anemia, fatigue, weakness, pale skin, or shortness of breath with activity. This does not mean every parasite causes anemia. It means the specific organism matters. Other infections may disturb appetite, bowel rhythm, hydration, or the balance of gut bacteria. A person may feel as if digestion never fully resets after a stomach illness. They may have several normal days, then suddenly experience bloating, loose stool, cramps, or fatigue again. This repeating pattern is one reason parasites can be confusing. The symptoms may not scream infection. They may look like aging, food sensitivity, stress, or irritable bowel syndrome. But there is a difference between occasional indigestion and a pattern that keeps returning. If stool changes, fatigue, weight loss, anemia, greasy stools, or nighttime itching appear together, the question should not be, what cleanse should I try first? The better question is, what is disrupting my gut, and has it been properly tested? Because once the gut ecosystem is disturbed, guessing can keep the real cause hidden. After 60, intestinal parasite symptoms can be missed for one simple reason. They often look like something else. A senior feels tired, and people say, that is just aging. Digestion changes, and it is blamed on stress, medication, or a sensitive stomach. Appetite drops, weight changes, skin itches, or bowel movements become irregular, and the pattern may be treated as separate problems instead of one connected signal. That is where the danger begins. Older adults often take more medications than younger people. Some medicines can slow bowel movement, change stomach acid, irritate the gut, or alter the balance of bacteria in the intestine. Acid-reducing drugs, for example, may be necessary for reflux or ulcers, but stomach acid is also one of the body's first barriers against swallowed organisms. No one should stop these medicines without a doctor, but long-lasting digestive symptoms should not be ignored. Bowel motility can also slow with age. Less movement, dehydration, low fiber intake, pain medications, iron supplements, and other prescriptions may all contribute to constipation or irregular stools. When the bowel rhythm is already disturbed, an infection can be harder to recognize. The immune system also changes with age. It may not respond as quickly or as strongly as before. For someone undergoing chemotherapy, taking corticosteroids, using immune-suppressing medication, or living with a serious chronic illness, even a gut infection that seems mild at first can become more persistent or more dangerous. This is why the story matters. Did the symptoms begin after travel, after camping, after swimming in a lake, after a stomach bug that never fully cleared, after eating suspicious food, after close contact with someone who had diarrhea? Those details may be more important than they seem. The mistake is not that every senior with bloating has parasites. That would be false. The mistake is assuming parasites are impossible simply because the person is older, lives in a clean home, or already had one negative test. When symptoms keep returning, the body may be asking a more specific question, and that question cannot be answered by guessing. It needs the right test. This may be the most important part of the entire video. If the wrong test is ordered, the real problem can stay hidden. Many people hear the word stool test and assume everything has been checked, but stool testing is not one single thing. Different tests look for different causes. A routine stool culture is usually designed to look for bacteria such as Salmonella, Campylobacter, or certain forms of E. coli. That can be useful when bacterial food poisoning is suspected, but it is not the same as looking for parasite eggs, cysts, or microscopic organisms. For parasites, doctors may consider an ova and parasite exam, often called O&P. Depending on the symptoms and exposure history, they may also order Giardia antigen testing, Cryptosporidium testing, PCR-based stool panels, or other specialized tests. This is why a person can be told, your stool culture was negative, and still not know whether parasites were ever properly investigated. There is another problem. One sample may not be enough. Some parasites are not released into every bowel movement. The amount may rise and fall. Eggs or cysts may be missed if the sample is taken on the wrong day. That is why clinicians may ask for several stool samples collected on different days when parasites are suspected. This is not because doctors are being dramatic. It is because the biology of parasites can make detection difficult. Giardia is a good example. Symptoms may come and go. A person may have several bad days, then a few normal days, then the bloating, foul stool, cramps, or diarrhea returns. If the test happens during a low shedding period, the result may not tell the full story. So what should you ask your doctor? Ask, was my stool tested only for bacteria, or was it also checked for ova and parasites? Ask, do my symptoms fit Giardia or Cryptosporidium? Ask, do I need more than one stool sample? Ask, should we check blood counts, iron, B12, or signs of dehydration? These questions are especially important if symptoms started after travel, camping, lake water exposure, suspicious food, close contact with someone who had diarrhea, or a stomach infection that never fully resolved. Do not demand a parasite test for every minor stomach upset. That is not the point. The point is to match the test to the pattern. If your symptoms are recurring, unexplained, or connected with weight loss, greasy stools, anemia, nighttime itching, or immune weakness, then guessing is not enough. The right test can change everything. And once the right organism is found, the next mistake is trying to replace real treatment with a homemade cleanse. Once a parasite is suspected or confirmed, the biggest mistake is trying to replace real treatment with a homemade cleanse. The word flush sounds simple, but parasites are not all the same. Giardia is not treated the same way as pinworm. Hookworm is not the same as Cryptosporidium. A tapeworm is not the same as an amoeba. Each organism has its own life cycle, its own way of spreading, and its own treatment approach. For Giardia, healthcare providers may use medicines such as tinidazole, nitazoxanide, or metronidazole, depending on the patient's medical history, nutritional status, immune condition, and symptoms. For pinworm, treatment commonly involves 2 doses, with the second dose given 2 weeks after the first because the medicine kills worms but not the eggs. For hookworm, treatment is usually short, often 1 to 3 days, and people with anemia may also need iron support. That is why guessing can fail. A food may support your gut, but it cannot identify the organism. It cannot tell you whether your household needs treatment. It cannot confirm whether anemia is from blood loss, poor absorption, or something else entirely. So the safest way to flush out parasites begins with 3 steps. First, identify the likely organism with the right test. Second, use the treatment recommended by a qualified clinician when infection is confirmed or strongly suspected. Third, reduce the chance of reinfection. That third step is often ignored. Wash hands carefully after using the bathroom and before preparing food. Keep fingernails short if pinworm is suspected. Wash bedding, towels, and underwear in hot water when directed. Avoid swallowing water from lakes, rivers, pools, or poorly treated sources. Wash produce well. Be careful with food and water during travel. Now, where do natural foods fit? They belong in the support phase, not as a substitute for treatment. Garlic, ginger, pumpkin seeds, cloves, and soluble fiber may help support digestion, bowel regularity, and the gut environment. Fiber can feed beneficial bacteria and help stools move more normally. Ginger may ease digestive discomfort in some people. Hydration and electrolytes are especially important when diarrhea is present. But these foods should not be presented as a guaranteed parasite cure. Do not rely on a parasite cleanse if you have weight loss, blood in the stool, fever, dehydration, anemia, severe fatigue, or symptoms that keep returning. The most dangerous cleanse is the one that makes you feel busy while the real infection stays untreated. Real gut recovery is not just killing something. It is diagnosing correctly, treating safely, preventing reinfection, and then rebuilding digestion with simple, steady support. Before you try any gut support routine, know the warning signs that should not wait. Seek medical advice promptly if you have unexplained weight loss, blood in the stool, black stool, fever, severe abdominal pain, repeated vomiting, dehydration, or diarrhea that will not improve. Also pay attention to stools that are greasy, unusually foul-smelling, pale, or floating for days or weeks. For seniors, fatigue can become serious quickly. If tiredness is so severe that it interferes with walking, eating, bathing, or normal daily activity, do not assume it is just age. If confusion appears suddenly during diarrhea or dehydration, that also needs urgent attention. People with weakened immune systems should act even sooner. This includes anyone receiving chemotherapy, taking immune-suppressing medication, using long-term corticosteroids, living with advanced illness, or recovering from major surgery. Tonight, take 3 simple steps. First, write down your symptoms. Include bowel changes, bloating, cramps, itching, fatigue, weight loss, travel, lake water exposure, suspicious food, and when everything started. Second, look back at your previous tests. Was it only a stool culture for bacteria, or did it include ova and parasites, giardia, cryptosporidium, or a modern stool panel? Third, ask your doctor whether your pattern deserves more targeted testing, especially if symptoms keep returning. The safest way to flush out intestinal parasites is not a blind cleanse. It is the right test, the right treatment, prevention of reinfection, and gentle gut support afterward. If your symptoms keep coming back in cycles, comment gut below and subscribe for the next video on what your stool may reveal about digestion after 60.